Hello, good morning everybody. I'm Councillor Nigel Bull and I'd like to welcome you all to the June gathering of the Health and Wellbeing Board. At this meeting, I'd like to welcome everybody and we'll go around in a few minutes and just get everybody to introduce each other if that's okay. But in particular, I'd like to welcome James Wood and Tony Ellman to the meeting, coming along today, so thank you very much. So, as I say, I'm Councillor Nigel Bull, and we'll go around the room starting with that lady over there, please.
Hayley Waller, Policy and Insight Manager, Doncaster Council.
Sheena Clark, Policy and Insight Manager, Doncaster Council.
Simon Azir, Public Health Theme Lead, Doncaster Council.
Claire Henry, Public Health Principal.
Rihanna Nelson, Director of Children's Services.
Morning, Rachel Leslie, Director of Public Health at Doncaster Council.
Good morning, Ruth Bruce, Doncaster Place Development Lead.
Morning, I'm Elsa Layton, Deputy Place Director at the ICB in Doncaster.
Morning, I'm Tony Ullman from Doncaster Culture and Leisure Trust, Head of Digital Innovation and Funding.
Morning all, Nabil Al-Sindi, I'm a GP and I'm Medical Director for Doncaster at the ICB.
Good morning everyone, James Woods, Chief Executive Citizens Advice.
Good morning, I'm Glenys Smith, Councillor for Hatfield Ward.
Morning, Nikki Greenfield, Public Health Improvement Coordinator at the Council.
Morning, Louise Robson, Public Health Lead here at Doncaster Council.
Hi, I'm Fran Jo, I'm from Health Watch.
Hi everyone, I'm Sarah Smith, Councillor and Cabinet Member for Adult Social Care.
Hi, I'm Rio Overton Bullard, Public Health Improvement Officer at Doncaster Council.
And I'm Phil Holmes, Director of Adults Wellbeing and Culture in the Council.
And I'm Anthony Fitzgerald, I'm Executive Place Director for NHS South Yorkshire and I'm the Vice Chair of the Health and Wellbeing Board.
Okay, thank you everybody. It's also noted at this time we need to look at sort of like if there's been any apologies for the meeting. I've got Chris Margrave from St Ledger Homes. Is there any other, Caroline?
Yes. James Wood and Tony Ellman. Apologies, I'm reading the wrong bit. Chris Margrave and Councillor Lani Mayball. Apologies.
Thank you very much. That's fantastic. Lovely. Okay, so today we are not expecting a fire practice. If the alarm sounds, please leave the building by way of the fire exit through the doors at the rear of the chamber. When you have left the chamber, proceed down the stairway and exit through the emergency exit on the ground floor. If there is anybody with mobility issues, please await in the refuge area at the top of the stairs where the emergency evacuation lift is located, and use the intercom situated to the left-hand side of the lift doors to call for assistance. The designated assembly point is in the public square in front of the cast, beyond the fountain itself. I would like to inform any members of the public and press that today's meeting will be audio and visually recorded, and by entering the council chamber you accept that this will be recorded and your images retained and broadcast by the council on its website and on YouTube. If anyone intends to record or film any part of today's meeting, please ensure that this does not disturb the conduct of the meeting and you only focus on those the recording of people that are actually participating. I've just noticed that we've got a few people that's turned up a wee bit late, if that's okay. So what I'm going to ask those people to do is to give a bit of an introduction, if that's all right. So welcome. So Richard, do you want to start?
Yeah, good morning everyone. I'm Richard Parker. I'm Chief Executive of Doncaster and Bassett Law Teaching Hospitals.
Morning, Laura Sherburn, Chief Exec, Primary Care Doncaster.
Good morning, Lucy Roberts-Shaw. I work for DARTS and I represent the Health and Social Care Forum.
Hi, I'm Toby, I'm the Chief Exec of Ardesh.
I'm Vicky Barrozel, I'm a consultant from DRI.
I'm Lynn Rayner, I'm Lead ACP from DRI for Frailty.
I'm Anna Wright, I'm the Therapy Team Lead for the Rapid Assessment Programme team working at DRI.
Okay, thank you for that, and again, welcome to everybody to the meeting. With everybody's indulgence, what I'd like to do at this point in the agenda is actually bring forward Chair's announcements. Is that okay? One of the things I wanted to do during Chair's announcement is obviously sort of like pay tribute to our previous Chair, Councillor Rachel Blake, who has stepped down from the Cabinet because of work commitments. I think it's fair to say that, you know, Rachel and chairing of this forum, this group, this board, was absolutely fantastic, and it's lasted for quite a few years. She's always been extremely caring and collegiate in terms of sort of like how she's worked with partners on this board, and the actions that she's taken, and the way she's sort of like managed this duty, to some extent has encompassed Choose Kindness and the initiative that she launched. So I think it's only right at this time that we recognise that, and I'd like anybody, if they wish to make any comments to support that.
Thanks, Chair. Yeah, I would like to echo those words. I think Rachel made an incredible difference in a place as chair, and some of the documents that we're going to be seeing today is another part of her legacy. And I look forward to working with her further in a different roles that she'll take on from here, and wish her good luck. But I feel incredibly grateful to have worked with everybody under Rachel as chair.
Thank you for that, Sarah. Laura, you've got your mic on. All right, okay. Richard.
Yeah, thank you, Chair. I would also echo those sentiments. I think Rachel was challenging and supportive in equal measures, which I think is a really great trait of someone who chairs a board like this. So I personally, on behalf of my services and NHS colleagues, would echo your sentiments.
Rachel.
Thank you. Rachel, having a particular skill to match what the items were on the Health and Wellbeing Board agenda to what the Health and Wellbeing Board could do and what the role was there. And with that kindness, particularly the listening ear for any public questions that we had as well, and being able to respond with support and kindness through to those.
Thank you for that, Rachel. That's great. I do realise that obviously I've got some big boots to sort of like fill. I'll do my best as chair leading forward for this municipal year, and I'm happy to be sort of like pulled to account by any one of you if you feel that I'm not doing that to the best of my ability. At that point, we'll move on to item 2. It's actually item 3 now, which is basically the appointment of Vice Chair for the 2024-25 municipal year. Can I have nominations, please, for the Vice Chair of the Board? Sarah.
I'd like to nominate Anthony Fitzgerald for the position of Vice Chair.
Thank you, Sarah. Do I have a seconder for that?
Yes, I second that.
Is that all agreed by everybody, that Anthony Fitzgerald takes up the Vice Chair position? Thank you. At this moment in time, colleagues, I do apologise, but I've got a very urgent meeting to attend, which I need to be at. So what I'm going to do is vacate the chair and surrender it to your Vice Chair, Anthony, for the rest of the meeting. I can assure you that this won't be a regular occurrence, but it's something that I can't get out of, and I do need to depart. So although it's been very short and sweet, I look forward to working with you in future. Thank you very much.
Thank you, Councillor Ball. I'm reminded of a Fools and Horses sketch about Peckham Council where this happened, but okay. We'll continue with the meeting then, please. So item 4 is exclusion of press and public. There are no items on today's agenda where the press and public are to be excluded. Item 5 is declarations of interest, if any. Does anybody have a disclosable interest or other interest to declare in relation to the business on today's agenda? If so, please declare it now and complete the declaration form available from Caroline in Governance Services. No? Thank you. We're on to public questions. This is a standing item on the board agenda, and it's aimed at providing an opportunity for members of the public to ask a question or to make a statement. Please note that questions or statements should relate to an item of business on the agenda for today's meeting. Are there any elected members or members of the public attending today's meeting who wish to put a question to the board? Well, this is going very well, isn't it? That's great. Okay, right, we're on to the minutes of the Health and Wellbeing Board on the 7th of March this year. The minutes of the board's last meeting are attached in agenda item 7 of the agenda papers. The board is asked to consider and approve these as a correct record. Can we agree the minutes as a true and accurate record? Thanks, Sarah. Okay, and I'll sign those, Caroline. So we're on to item 8, which is the Health and Wellbeing Board Annual Report. This is a verbal update and presented by Louise. There you are, Louise. Great. Please update the board, Louise, and present the annual report.
Okay, everybody, I've only got 5 minutes. I'm going to be very quick, just to give a quick overview, really. Hopefully you've all seen the report, which is taking over most of the papers this time. Just to say, this is the 3rd annual report that we've done for the board. We've only been doing them for the last 3 years. Not all health and wellbeing boards have one, but we're an exemplar of good practice because we have one every year. The work actually in the report isn't all produced by me. I just coordinate all the reports. So I'd like to thank all the contributors, and particularly to Claire Hewitt and Amber Rose, who've helped me pull this together. It's a celebration of the work of the board for the last year. You might be reading it and thinking, I don't remember all that, but it's actually capturing all the partner organisations and all the work that contributes to the work of this board. It builds on the foundation of the last 2 reports that we've done, and if you've probably seen the previous reports, it's following the same format and structure that we've done for the last 2 years. And it just made sense because it worked really well that we follow the same structure. What I will say is as the board changes and there's new priorities and the new strategy, the annual report next year might look totally different. But for this year, we've stuck with the same format that's working. So what I did I can't pull everything out, Chair, so what I wanted to just point out is that the structure is the same. The areas of the report cover what the board does, what it's about. It brings in demographics around Doncaster, but most importantly this year, it brings in the shift towards lived experience at the board. And I think that's been the biggest shift in the last year. We've had lots and lots of presentations. The different thing this year in the report was the last section where we particularly focused on those items that have come to the board. So the first part of the report is all the background, the JSNA, the mandatory things that we have to do, the attendance at the board, who actually comes to the board. It talks about the strategic direction of the board, the life course themes. So I'm not obviously going to go into all those. You can read all that in the report. Lots of really positive examples of partnership working and projects in Doncaster. We've had a forward from Councillor Blake, and as we've recognised earlier, she was a great chair. Nigel's got a big act to follow, but also a really good contribution from Anthony as well in terms of that lived experience and what the board has done for the last year. It also shows a commitment to the ways of working. So we've got the Get Doncaster Moving movement in there, the compassionate approach, health inequalities, our commitment to research, our commitment to heritage, arts and culture, and particularly the work bringing in the voluntary sector. So we have got examples in there of lived experience from the Learning Disability Partnership, the Deaf Society, the Dementia Collaborative, Shaping Stainforth, and the GRT and Community and Health Inequalities. So what I'm trying to say is there was so much stuff to get in that report. We struggled to get it down to the pages that we have. I hope people feel that it does demonstrate a really good mixture of things that we've done across the board. And I think the important thing to say, because I know I've gone over my 5 minutes, is the recommendations at the end. So if you haven't read them, the 6 recommendations. The first one is to complete the refresh of the health and wellbeing strategy, and we're going to be doing that today and signing that off, hopefully, Claire. That's been a driver for the changes in the board, and that's one of the big recommendations for this year. Alongside that, to review the way the board works in terms of delivering that strategy, and the way we're doing the meeting today is the start of that journey, doing it slightly differently. To develop a 12-month forward plan. So for those who, like me, who've been involved in the board for 12 years, we've done the forward plan for years, but it's kind of lost its momentum a little bit. So the new way of working will hopefully help us with the LGA, and I'm looking at Claire because I know she's working with the LGA, to move that forward in terms of a 12-month plan. We're also going to continue to include the voice of our voluntary sector and faith sector and community sector. We also have a pharmacy needs assessment that I've had the pleasure of doing for the last 12 years, that we do every 3 years. That is due for refresh again in 2025. And the other area that we want to develop is aligning to our new Thrive model in the council, the community prevention and the community-based approaches. So the recommendations are at the end of the report, and I think I'll shut up now because I've gone over, sorry Chair, but I hope people find it useful and interesting, and I'll take any questions now. Thank you.
Thanks, Louise. I'm going to open it up for comments or questions. Before I do, can I thank everybody who's been involved in producing this? I think it's a substantial piece of work and it reads well. One thing that strikes me is the list of contributors on the first or second page, which are truly multi-organisational. So I think that shows the commitment to a partnership working across Doncaster. So a big thank you for everybody who's been involved in producing this report. Toby.
Yeah, I'd echo that. So it's more of a comment than a question. I'm so sorry. So I'm really supportive of what's here. I have an aspiration for next year's report. And my aspiration for next year's report is it's much, much clearer in its evaluative content of whether things have worked or had any meaningful outcome. And I guess that's consistent with our away time in February, where we talked about focusing on fewer things and being clear about their impact. Because, Anthony, if I look at the list, some of the things that are listed in here that are in areas I'm involved with, some of them have happened, some of them have been thought about, some of them have worked, some of them haven't. And if that was to be extended across the whole list, we could be less busy and do more for our population. So it's a plea to build an evaluative model into our work this year. That makes sense.
It does, and I think it's an excellent point, and it plays very much, I think, to the recommendation 2, which is the review of ways of working to deliver the health and well-being strategy, and the key word in there, I think, is deliver. You know, so we can definitely build that recommendation in. I think it's a good one. Phil.
Yeah, it's not a comment. I think, again, it's good, and I agree with Toby's points. I like the list of participants because also people with lived experience are represented there. So for example, Raymond Humphrey's name is there. Raymond is a person with lived experience who's driven a lot of improvement. So it's good that we've talked about lived experience in the document, but we've also explicitly credited people who are bringing lived experience to the work. And it's a good, I mean, legacy makes it sound like Rachel's long gone, but it's a good legacy to Rachel around lived experience. Probably the bit from the recommendations that's probably not there in the way that I would associate with Rachel would be being very uncompromising about equality, diversity and inclusion in the work of this board over the next year. So it's the sort of thing we can pick up, and I know it runs through it, but I just think it's really helpful to, we're not going to do health and well-being well if we don't do equality, diversity and inclusion well. So just to pick that up.
Thank you. Hope all this is helpful, Louise, when we come into the workshops that we've got.
That's
Okay.
great.
Councillor Smith.
Yeah, just to echo Phil there, I think it's a really good point. And I just wanted to highlight that there are some really fantastic pieces in there. I really love for us to take forward the case studies. I don't know if it has a better term next time, but yeah, sort of case studies. I really enjoyed those because it really grounds it in the practice and people's lives and kind of makes it tangible to an outside audience, because I feel like sometimes like I imagine this document is a little bit more outside facing rather than inside facing. And I just wanted to highlight some really good things that I really liked reading about, which was Well Doncaster's fantastic work, the Learning Disability Partnership, which is an incredible piece of work that's always ongoing and always evolving. There was a piece, a really fantastic stat about young carers in there, which was it's increased by, I think it was 45% or 40% from the year before, which I think is incredible. And if we can continue going forward with that, that'd be brilliant. And of course, I would always love to see more focus on carers, unpaid carers generally. So that'd be great. Thank you.
Thank you very much.
I'm also impressed that the Learning Disability Partnership Board's in there, as I actually co-chair that board. I would like to, in a way, make a plea, because I've been attending Partnership Board both as a health professional and now as a councillor and the co-chair. And what we need are some young people with learning disabilities, some teenagers, and people who are coming up through the education system for us to keep evolving, and some young parents. I speak to some of them regularly in the Hatfield ward, and I think if we could just get some influx of new younger parents and people with a learning disability, that would make such a difference.
Thank you. Did you want to come back in that? Yep.
Fantastic point, Glynis. Before I went away, I met amazing young people at DICE, and they are super up for joining. I have sent an email, so I don't know. I'll CC you. I'll reconnect you. Yeah. Or we'll connect you. Brilliant.
Thanks, Glynis. So thank you for all those comments. We've got the recommendation, which I'll come to in a moment, but just to check, really, this report, previously we've asked individual organisations to socialise the report within their own organisations. Is that the intention this year? Ruth, I'd like to see this on the ICB governance. Same intention, yeah.
I'm looking at Ray.
Yeah.
Yeah, so it will form part of our JSNA pages, so it can go onto their previous annual reports, have it's there for information and inspiration. It really useful to hear about the comments from the group, and quite a challenge there of focus around things that we can do well, but still wanting to include lots of things we've seen previously. So as a group, we can do that. And yet would welcome the inclusion of this as a report on any other groups, or sending through to partners, or offering individual briefings to other groups if that's useful too.
Thank you. Okay. So the board is asked to consider and endorse the Health and Wellbeing Annual Report for 23-24 and recommend to take to full council. Is that agreed? Thank you.
Look, sorry. It'll also be on the Health and Wellbeing Board page, obviously, as well on the website.
Thank you. Okay, onwards and upwards. The Health and Wellbeing Strategy. Rachel, you're down on this one, to provide a presentation and to update the board on the Health and Wellbeing Strategy. Claire, Rachel.
Okay, thank you, Chair. So, ooh. In the papers, I've asked you to as well. So in the papers, I've asked the board to consider and endorse the Health and Wellbeing Strategy. So we've all been looking at that over the last 6 months as a board. And just to set some context, around the local health and wellbeing strategy. It is there to set the vision and priorities for the Health and Wellbeing Board, and also to reflect the challenges that are identified in the JSNA. So we've been looking at that over the last 6 months as a board, and we've done a development session in February to look deeper into those areas of focus that we wanted the board to focus on. The strategy is there to provide a strategic assessment. So it's to provide those areas of focus and priorities that the board wants to really deep dive into, as we understand that we can't do everything as a board that only meets 4 times a year for a few hours each time. So just to remind of where we're up to in terms of the journey. So we started off about 6 to 7 months ago in terms of synthesising all of the information that we'd already got from each of the health partners. We brought all that information together and we reviewed the JSNA to look at those areas of focus. Now, we've been doing this in parallel with the ICB and their 5-year forward plan because we understood that we needed, that they both use the same sets of data, they look at the same evidence and they look at the same insight. So we've been doing that in parallel. We also then have taken that back out to residents to sense check some of the information that we were theming, and we've also been to elected members to get their views from their constituents around what is important for people around their health and wellbeing in Doncaster. We've also been lucky to get support from the Local Government Association to provide some support and do a little bit of a sense check about what other areas are doing, what are areas of best practice and what we can learn from. Because obviously Doncaster has a very good health and wellbeing board, but we want to make that even better. So what is the best we can do for Doncaster's health and wellbeing board? We had the development session in February where we had a few hours to be able to really discuss what we wanted to do. And you challenged me to come back to try and bring 3 areas of focus. So we've got 3 areas of focus for the health and wellbeing strategy at the moment. And we wanted to do things differently. So we've been having discussions and conversations about how we can do that. And the way that the board's working today is how we want to try and move forward the Health and Wellbeing Board's way of working. So the draft paper went out on the 8th of May. The draft strategy went to all Health and Wellbeing Board members to gather comments, to gather feedback so that we can then look at being able to take that through the approval process. We've got one vision around adding life to years and years to life, and we've got 3 areas of focus. So close the women's and child health gap, so looking at those inequalities in children and women's health and wellbeing challenges. We wanted to improve the experience of ageing, and that's what we're going to look at today. And then we want to create healthy places, so healthy places for residents in Doncaster to live, grow and play. And then we've used the Fairness and Wellbeing Commission as a foundation to look at our 5 ways of working. So on there we've got around intersectionality, so looking at where inequalities compound each other and where we really need to look at health inequalities in a much deeper way. We've got around community-centred approaches, and that links to the Thrive model that the local authority are driving forward at the moment. We want to look at health equity in all policies, so not just about health in all policies, but that health equity that has already been described earlier around the annual report. We want to look at a compassionate approach, and that's following the Choose Kindness and the ways of working that the board has been working towards. And also we want to look at evidence-informed. Varifocals. Really sorry, everybody. I've got varifocals in and I can't work. And it's my own fault. It's my own slide. Evidence-informed. So we've been very clear that anything that we want to focus on as a health and wellbeing board needs to be based in evidence. It needs to be shown to have worked or is working, and where we might want to trial things that we're actually evaluating that, and we can bring that evidence and impact back into the way what we're doing. And then we've got some products that the Health and Wellbeing Board will have. We've just talked about one earlier, which is the annual report, pharmaceutical needs assessment Louise has talked about, the Ethnic Minorities Action Plan, and also the Director of Public Health annual report. So these are all opportunities and products that we can use to be able to look at the impact, look at the progress, and look at work going forward of the Health and Wellbeing Board. So, as I said before, I have asked that the board consider and endorse the Health and Wellbeing strategy as it is. It is high level. We have got that as high level areas of focus, and we do need to work about what is it that we really want the Health and Wellbeing Board to support over the next 7 years, the life of the strategy till 2030. So there's more work to be done. So there isn't anything in the strategy that's very action orientated at the moment, and we can start to progress that as we go forward. And we've got the support of the LGA to be able to do some of that work if we need to. If it gets endorsed today, which is the 6th of June, we will hope to then take that forward for final approval in September to full council. So that is the approval process if we approve today. And then just to remind you of how we're going to work, these are the ideas of the thinking to go forward from today is around those 3 areas of focus and the development sessions that we are proposing that we'll work on. We'll see how today goes, we'll see where we get to, and we might want to think of different ways of working if we don't feel that it's getting us to where we want to be. But we did talk about, as a Health and Wellbeing Board in those development sessions, about being very specific around what we want the board to do, what we want to achieve, and how we do that together. Okay, I'm going to pause there. Apologies for my cold. Has anybody got any questions or thoughts or comments?
Okay, thanks, Claire. Thanks for putting that together. I'm going to open it up, but just some initial thoughts from me is that I think it reflects the conversations that we've had through our development workshops at a high level, particularly those areas of focus. There's clearly more work to be done in terms of the devil's in the detail, and I'm picking up Toby's point earlier around let's really be clear on how we're going to evaluate whether we're being successful or not. The final point is, and we'll see later, there is an element of suck it and see on this, isn't there, from the new ways of working, and we'll see how the development session goes later. But from my viewpoint, I think it does reflect the conversations that we've had. Sorry, I've just remembered a question. You could tell I was waffling. It was the LGA support. So quite a few of us took part in those conversations. How is that going to happen going forward, or how has that been fed back as such?
So we've got the opportunity to have another development session, but led by the LGA to do that. So Steve Benser, who's the associate from the Local Government Association, has met with a number of Health and Wellbeing Board members to have some in-depth conversations and to be able to maybe provide some recommendations for the Health and Wellbeing Board, and in his words, to become excellent and be gold standard. So he does acknowledge that he thinks that we've got a very good Health and Wellbeing Board, that it does do lots of good things, but how can we move it forward to that excellent stage? So we've got the opportunity for him to come in and do a workshop. What we said we would do is have a conversation to decide what that wants to look like, and what are the gaps, what the help do we want, and what are the support that we need. So we've got that opportunity in the next couple of months to be able to do that.
Okay, we may return to that then. Okay, thanks. Toby.
So I've got two comments. I'm very supportive of this, so they shouldn't be heard as anything other than supportive comments. So one is a slight anxiety that by compositing women's and child health together, rather than having both of them there, but as having separate focus, my sort of lived experience over the years is that tends to slightly narrow what we choose to mean by women and child health in all sorts of stereotypical ways that members can probably imagine. So I suppose that's just a kind of reminder to myself to make sure we don't allow that to happen. The second, which is a more, I suppose, a question is, at one point, child health was conceptualised almost entirely through oral health, and I think some of us had asked for child mental health to be incorporated within that, and I just wanted to check whether that had happened. I mean, I'll vote for this anyway, but it'd just be ever so helpful if it had. Thanks a lot.
Do you want to come back on that, Rachel, please?
Yeah, so that can happen. What we'll see a bit later is how we begin to explore that at our area of focus around improving the experience of ageing. We would suggest that we do the same again around closing the women's and children's health gap. When we looked at the JSNA data, there was a clear case around women's healthy life expectancy, as well as around children's, and would see again through my experience that impact of family as well, not always women, fathers as well, but having that link within women's and children's health, as well as there being resource and focus around women's health too.
And then just to follow on from there, there's various other forums, Toby, that we do address some of the children's health agendas, in particular mental health, physical health, in terms of disability, etc. So if the Health and Wellbeing Board would like some assurances of where else children's health stuff is happening, we can do that.
Phil.
Yeah. So I think it's good. I think what will be really helpful, and part of me can't believe I'm about to say this, but what will be really helpful is to be really clear about our relationship with the South Yorkshire Integrated Care Partnership and the strategy from that. Not because I think we can work in a very complementary way with the Integrated Care Partnership, which sometimes has felt a little bit at arm's length. So when we have a discussion later, we'll be talking quite a lot, I think, in relation to experience of ageing around the kind of bold ambition in the ICP strategy about acting differently together to strengthen and accelerate our focus on prevention and early identification. Through that, and we'll be doing that through all these three themes. But it was just helpful for us to remind ourselves that we're doing it and to connect with the ICP off the back of it. We won't be talking so much this afternoon or a bit later on about focusing on the development in early years so that every child in Yorkshire is school ready. But again, we need to have an explicit relationship between the work that happens here and the ICP. Economic participation and a fair, inclusive and sustainable economy is the third one. That might come up a bit later, but again needs to run through, because then we're working out then the things that we need South Yorkshire to support on, or things we might be able to inspire South Yorkshire on or get inspiration back from them on. And the last one is around workforce, but is specifically around a diverse workforce that reflects the needs of our communities. And there are various places we talk about workforce, but maybe not so much talking about diversity of workforce. So I think we could do with being really clear about the connections, not making an industry of it, but I just think if we're mindful enough, we'll be able to kind of face in both directions in quite a fruitful way.
Thank you, and thanks for the first point, Phil. I think we've had this discussion. We can do better, can't we? And for me, it's a balance, Phil, linking these very much to where we can to the Integrated Care Partnership, but also I think these are. We did some real work to say these are where we need to concentrate our efforts in Doncaster, don't we? So I think that's a balance that we can do more work on, but they can complement each other. So thanks for making that point, Cynthia.
Right. What I wanted to say, and I'm sure we're all thinking it, is that obviously there are some areas where the figures are very different, some of them next door to each other. And I just wanted to make sure that the areas where the figures are, at the lowest are really concentrated on, because, some of those figures are heartbreaking and need to be addressed as a matter of urgency. Some areas can be next door to each other and have, very different outcomes for health. So I just wanted to make that very clear.
Yeah, and thank you for doing that. I'll bring Rachel in, but that came across very much, didn't it, Cynthia, through the Fairness and Wellbeing Commission that we put together, and that needs to be implicit in the work that we're doing here, Rachel.
So first, I was going to check that you meant geographical places, which I think as you were talking, that is exactly what you mean. So yeah, there's a few things that can support the Health and Wellbeing Board around that. So principally the JSNA, and particularly the new community health profiles that have been generated around that. So I'll talk about a concept of proportionate universalism, which some people, most people, all people in this room will understand, about how we allocate the resources that we've got to those that need it most, with the aim to improve everybody's life overall. And on the slides that Claire showed earlier about some of those principles that we take, we identify particular groups, whether it's the place that they live in Doncaster, or whether it's some of that intersectionality, so the experiences they have in their life, their age, their gender, their ethnicity. All of those elements will make life, access, all of those things easier or more difficult for people, and that must be core to the work that we do and partners do in delivering services, focusing resources.
Thanks, Glynis. Sorry, Rachel, all is forgiven, isn't it? Come back. Okay then. Any more comments on that? Great. Okay, I think it's in a good shape, this, and the board is asked to consider and endorse the newly revised Joint Local Health and Wellbeing Strategy and recommend to take to full council for approval. Thank you.
Sorry, I'm happy to support
Yep.
you. I've got a question about, well, it's the same question as you asked us previously about socialisation. Are we expected to present this at our boards before it's got final approval, or to wait? Because boards may have additional or other comments to add to the discussions.
So the way that we'll present it now as endorsement for the board is our completed strategy for the Health and Wellbeing Board. It will then go through its governance journey all the way to full council. As a draft format, I think it's fine to socialise, but I would wait until it's that signed off version at full council. So I'd say fine to talk about our focus areas, and we certainly will be doing that today. But in terms of having a completed, signed off, verified document, I think we could then take that round to places where that's needed to.
Just remind me when that time frame was, Claire.
So full council's September. And also, can I just add, and I forgot to say this, so apologies, the strategy that we've written, obviously, I quite clearly said in my email, needs these design elements into it, but also Councillor Smith and I and Ruth are going to get together to look at a resident version of the strategy. So obviously we know our residents aren't interested necessarily in what a 5-year plan is and what a health and wellbeing strategy plan is, but they are interested in what we're doing for Doncaster around health and wellbeing. So we're going to look at how we can do that in a resident focused way as well. So we'll bring that to the board once we've decided how we want to do that.
Thank you, Toby.
Can I just check? So my working assumption is we're going to focus overwhelmingly on these three things and not on other stuff. And I'm really supportive of that, but I just wanted to check that the not on other stuff bit isn't just something I've made up all on my own.
Can I just get a sense check in the room, because that's my understanding. And I think we all need to hold each other to account that there isn't creep in this, which I think there has been over the course of the last, naturally through some of these health and wellbeing boards. So a real rigour to concentrate our agendas accordingly on this. Rachel.
Yeah, so in preparation for launching this as the new strategy, we've done that housekeeping of what was on our forward plan for the Health and Wellbeing Board, and we've sent or suggested where items that were on the forward plan may belong. This isn't the only group meeting, so there are other opportunities and other forums to send those items to. Yes, you are right, these will be our focus, our obsessions for the next period of the strategy. And the other bit that I just wanted to reflect as well, if I may, more than 10 years now of health and wellbeing boards being in existence, and that real change. I remember the first ones that were created were really kind of topic-based, alcohol, mental health, big or small, and these now feel people-based and experience-based. So yes, they will be refined, and I think we will have to do that check-in that we don't creep, because you could potentially tuck lots of things under each of those three areas. So helpful to have that nudge to say how are we strict with ourselves that we provide our focus here, but really pleased to see that we're focusing on people, experience and lives rather than individual conditions or, if you like, public health problems.
Thank you. So I'm hearing support for the recommendation. Thank you very much, and thanks for presenting that. So that concludes the open part of our meeting today. So thank you. The time and date of the next meeting is Thursday, the 5th of September, 9 o'clock in the Civic Office at Waterdale. Thank you.